We've all experienced that moment after a fall or bump when a bruise starts to form. The skin darkens, it's sore to the touch, and we know we've got a battle scar to show for it. But what if I told you that bruises aren't just skin deep? What if that ache in your bone after a hard hit is more than just a lingering pain? Welcome to the world of bone bruises, an injury that's hidden beneath the surface, more painful, and often slower to heal than the common bruise you see on your skin. What exactly is a bone bruise? Let's dive into what a bone bruise really is. Imagine your bones as tough, yet slightly flexible structures filled with tiny, intricate fibers called trabeculae. When you suffer a hard blow, these fibers can get damaged, causing blood and fluid to leak into the bone's marrow. This isn't the kind of bruise that turns your skin black and blue. Instead, it's hidden deep within the bone, creating pain, swelling, and stiffness that can last for months. Bone bruises are like the warning signs before a full-blown fracture. While a fracture is a complete break where all the bone's fibers snap, a bone bruise occurs when only some of those fibers are damaged. It's your body's way of saying, "We're hurt, but we're holding together for now." How do you know if you have a bone bruise? So, how do you spot something you can't see? The symptoms of a bone bruise can be surprisingly easy to miss. At first, you might just feel a deep ache that doesn't go away, even after the skin bruise has faded. There might be swelling around the area, and if the injury is near a joint, you could notice stiffness or difficulty moving it. The skin might change color, but it's what's happening underneath that really matters. Bone bruises are especially tricky because they often occur alongside other injuries, like fractures or ligament tears. You might feel joint pain or notice that your movement is limited. If you've been in an accident, fallen, or taken a hard hit while playing sports, these could all be signs that something more serious is going on beneath the surface. Types of bone bruises: what's happening inside? Bone bruises come in different types, depending on where the injury occurs. Let's break it down. 1. Subperiosteal hematoma. This is when blood collects just under the tough, outer layer of the bone. Think of it like a pocket of blood right beneath the bone's surface. 2. Intraosseous bruise. This type happens deeper inside the bone, where the bone marrow lives. It's like a bruise within the bone's core, where the blood and fluid start to build up. 3. Subchondral lesion. This is when the bruise occurs under the cartilage that covers your joints. A hard impact or a twisting motion can cause the cartilage to separate from the bone, leading to this type of bruise. Each of these types involves a different part of the bone, but they all have one thing in common: they hurt, and they can take time to heal. How do bone bruises happen? Bone bruises can be the result of one big impact or a series of smaller, repeated injuries. Here are some common ways they can happen. Direct hits. This could be from a fall, a car accident, or even getting hit during a sports game. The impact causes the bone to absorb the force, leading to a bruise. Twisting injuries. If you twist your body the wrong way, especially in sports like soccer or basketball, you could end up with a bone bruise as cartilage pulls away from the bone. Repeated stress. Sometimes, repetitive motions like running on hard surfaces can cause a bone bruise to develop over time. It's your body's way of reacting to constant pressure. One notable example is with ACL injuries. The anterior cruciate ligament, ACL, is crucial for knee stability, and when it tears, bone bruises often follow. In fact, a study showed that over 80% of adults with an acute ACL injury also had a bone bruise. This is common in sports like basketball, soccer, and skiing, where sudden stops, twists, and impacts are part of the game. Who's at risk for bone bruises? Anyone can get a bone bruise, but some people are more at risk. If you work in a physically demanding job or play contact sports, your chances are higher. Athletes, in particular, are at risk because of the intense and repetitive forces placed on their bones and joints. But even if you are not an athlete, a simple fall or accident could lead to a bone bruise. The best way to protect yourself? Wear the right protective gear and be mindful of how you are moving, especially in high-risk activities. Diagnosing a bone bruise. What to expect? If you suspect you have a bone bruise, it's important to see a doctor. They'll ask about your symptoms when they started, how they've changed, and what might have caused them. They'll likely check the area for swelling, tenderness, and color changes. If the injury is near a joint, they might test your range of motion. To confirm a bone bruise, your doctor may recommend imaging tests. While X-rays are good for spotting fractures, they won't show a bone bruise. For that, you'll need an MRI. This scan provides a detailed look at the bone and can reveal the buildup of blood and fluid that indicates a bone bruise. Treatment and recovery: how to help your body heal. Here's the tough part: there's no quick fix for a bone bruise. Healing takes time, sometimes up to a year, though most bone bruises heal within 3 months. While you can't speed up the process, there are things you can do to manage the pain and support your recovery. Rest: give your body time to heal. Avoid putting too much pressure on the injured area, especially if it's a weight-bearing bone like your leg or foot. Elevation: raising the injured area above your heart can help reduce swelling. Cold therapy: applying ice packs to the bruise several times a day can help manage pain and reduce inflammation. Pain relief: over-the-counter pain medications like acetaminophen can help manage the discomfort. Bracing: depending on the injury, your doctor might recommend wearing a brace to limit movement and protect the bone as it heals. Protecting your bones: preventing future injuries. Once you've experienced a bone bruise, you'll want to avoid going through it again. Prevention is key. If you're involved in contact sports or physical labor, wearing the right protective gear is crucial. Make sure you're also getting enough calcium and vitamin D, which are vital for bone health. And remember, if you notice your pain getting worse, or if swelling doesn't go down, it's important to seek medical attention. Bone bruises can sometimes lead to more serious conditions, like osteonecrosis, where the bone tissue dies due to a lack of blood supply. Conclusion: understanding and caring for bone bruises. Bone bruises might be hidden beneath the surface, but they can have a big impact on your life. They're painful, take time to heal, and can affect how you move and live. Understanding what a bone bruise is and how to treat it can help you manage your recovery and prevent future injuries. If you suspect you have a bone bruise, don't wait, see a doctor, get a proper diagnosis, and follow their advice. With the right care, you can get back to your normal activities, stronger and more informed than before.